Anything new? Something new? Well, this content is just for you.
Check these out. We're about to unravel and unleash the mysterious creature. We're gonna focus on the male reproductive system.
But first things first, if you're new to our channel, please like the button below and make sure you subscribe.
To formally begin this video, let me introduce to you my fellow reporter and myself. I am Augusto Cesar T. Saavedra and this is Vanessa May Sandoval. Disclaimer, this is an educational video that aims to help those who are puzzled about the male reproductive system. Don't you worry, we made it a lot easier for you to learn.
Without further ado, let's roll the camera. The male reproductive system is mostly located outside the body. These external organs include the penis, scrotum, and testicles. Internal organs include the vas deferens, prostate, and urethra. The male reproductive system is responsible for sexual function as well as urination.
So Ms. Sandoval, what's the male reproductive system?
The male reproductive system includes a group of organs that make up the male's reproductive system and urinary system. These organs do the following jobs within your body. First, they produce, maintain, and transport sperm cells and semen, also called as the protective fluid around sperms. Second is they discharge sperm into the female reproductive organ. So third is they produce and secrete male sex hormones.
Also, what are the internal male reproductive organs?
Most of the male reproductive system is located outside of your abdominal cavity or pelvis. The external parts of the male reproductive system includes the penis, scrotum, and testicles. Penis. The penis is the male organ for sexual intercourse. It has three parts. The root. This part is a part of penis that is attached to the wall of your abdomen. The body or shaft. Shaped like a tube or cylinder, the body of the penis is made up of three internal chambers. Inside these chambers, there's a special sponge-like erectile tissue that contains thousands of large spaces that fill with blood when you are sexually aroused. As the penis fills with blood, it becomes rigid and erect, which allows for penetration during sex, and the skin of the penis is loose and elastic, allowing for changes in penis size during the erection. The glans. This is the cone-shaped end of the penis, the glans which has also called the head of the penis. Next is the opening of the urethra, the tube that transports both semen and urine out of the body. And lastly, the semen, which contains sperm, is expelled through the end of the penis when the man reaches sexual climax or orgasm. So next, we moved on the other organs in the external part of the male reproductive system. So we focus on the testes. These testes are the oval organs about the size of a very large olives that lie in the scrotum and secured at either end of the structure called the spermatic cord. Most men have two testes. The testes are responsible for making testosterone, the primary male sex hormone, and for producing sperm. Within the testes are called masses of tubes called semiferous tubules, producing sperm cells through a process of spermatogenesis. Next is the scrotum. The scrotum is the loose pouch-like sac of skin which hangs behind the penis. It holds the testicles as well as many nerves and blood vessels. The scrotum protects your testes as well as providing a sort of climate control system, slightly cooler than the body temperature. Special muscles in the wall of the scrotum allow it to contract and relax, moving the testicles closer to the body for warmth and protection or farther away from body to cool the temperature. So we moved on the epididymis. The epididymis is a long coiled tube that rests on the backside of each testicle. It carries and stores sperm cells that are created in the testes. It's also the job of the epididymis to bring sperm to maturity. The sperm that emerge from the testes are immature and incapable of fertilization. During sexual arousal, contractions force the sperm into the vas deferens. So next is we moved on the vas deferens. This vas deferens is the internal parts of the male reproductive system. The vas deferens is a long muscular tube that travels from the epididymis into the pelvic cavity to just behind the bladder. The vas deferens transports mature sperm to the urethra in the preparation for ejaculation. Next, it will travel to ejaculatory ducts. These ducts are formed by the fusion of the vas deferens and the seminal vesicles. The ejaculatory ducts empty into the urethra. Next is the seminal vesicles. The seminal vesicles are sac-like pouches that attach to the vas deferens near the base of the bladder. The seminal vesicles make a sugar-rich fluid that provides sperm with a source of energy and helps the sperm ability to move. The prostate gland. The prostate gland is a walnut-sized structure that's located below the urinary bladder in front of the rectum. The prostate gland contributes the additional fluid to ejaculate. Prostate fluids also help to nourish the sperm. The urethra, which carries the ejaculate to be expelled during orgasm, runs through the center of the prostate gland. Urethra. The urethra is the tube that carries urine from the bladder to the outside of your body. Next is the bulbourethral gland. The bulbourethral gland or Cooper's gland are pea-sized structures located on the sides of the urethra. These glands produces a clear, slippery fluid that empties directly to the urethra. This fluid serves to lubricate the urethra and to neutralize any acidity that may be present due to residual drops of urine in the urethra.
Here, we're curious on how does the male reproductive system function.
The entire male reproductive system is dependent on hormones. These are chemicals that stimulate or regulate the activity of your cells or organs. So the primary hormones involved in the functioning of the male reproductive system are follicle-stimulating hormones, or also known as FHS, and luteinizing hormone, LH, and testosterone. FSH and LH are produced by the pituitary gland. It's located at the base of your brain and it's responsible for many functions in your body. FSH is necessary for sperm production. LH stimulates the production of testosterone, which is necessary to continue the process of spermatogenesis. Testosterone is also important in the development of the male characteristics including muscle mass and strength, fat distribution, bone mass, and sex drive. So my time is about to end, but I couldn't cover all the details alone. Can you help me continue the common illness and a possible treatment in the male reproductive system? And your personal reflection about it, since it suits you the most. So I'll be back later for the conclusion. See ya!
Sure thing, I got you covered.
Common illnesses and possible treatment of male reproductive system. So the erectile dysfunction, premature ejaculation, loss of libido, testicular cancer, and prostate diseases. It may cause embarrassment to the patient and occasionally the general practitioner or the known as GP. We describe how patients may affected by these conditions may present to general practice and discuss the reasons why they may not present. We also discuss how GPs can overcome difficulties in identifying and dealing with their male patients suffering from male reproductive system issues. For a useful consultation to occur, it is important that the GP is comfortable with both the patient and the problem, and vice versa. So first is the erectile dysfunction. It is defined as the inability to have or maintain an erection hard enough for satisfactory sexual intercourse. It remains one of the most common untreated conditions in Australia. A study by Pinnock showed ED is to be strongly correlated with age, with erection inadequate for intercourse affecting 3% of men aged 40 to 49 years, increasing to 64% of men aged 70 to 79 years, while in younger men, ED may be more commonly due to psychological causes. Example is performance anxiety. In many middle-aged and older men, the inability to achieve a hard erection is the result of faulty arterial flow to the corpora cavernosa of the penis, and pathophysiology being lack of blood flow rather than the lack of male hormones. So the symptoms of the disease or the disease. The importance of ED is being identified is that in the majority of men, ED is not a disease in itself, but rather than an early symptom of cerebrocardiovascular disease. Arterial narrowing initially manifests itself in the small arteries such as the penile arteries before narrowing or narrowing of larger arteries such as the coronary and cerebral arteries. Declares itself in the form of symptoms such as angina and transient ischemic attacks or TIA. If men become more open to discussing the sensitive issue of ED with their GP, they would benefit from the opportunity of having their occult cardiovascular disease being diagnosed and managed, thereby minimizing the risk of a premature heart attack. So the treatment, among the medication available at the primary care level for efficaciously treating symptom of ED is most affected males are P5 inhibitors. Examples are sildenafil, tadalafil, vardenafil. Contraindication should be noted, in particular the concomitant use of long and short-acting nitrates and nitrite-like medication is the premature ejaculation. Premature ejaculation, or PE, is a common and highly sensitive matter, and most men avoid broaching the problem with their GP. When raised either by the GP or the patient, a frank and supportive approach goes a long way to opening up conversation and working toward a more satisfying sex life for both the patient and their partner. Next is the libido. Libido relates to a person's desire for sexual activity and sex-seeking behavior. Levels of libido vary from person to person, and there is considerable individual variation, with libido changing across relationship as well as different social and environmental circumstances. So assessment and management is loss of libido is not an uncommon presenting symptom in general practice and can be affected by many factors including fatigue, stressors, lack of psychologically well-being, relationship problems. Next is the testicular lumps or testicular cancer. Although it is rare, it is diagnosed in about 750 Australian men annually. It is the most common solid cancer in men aged 18 to 39 years. Risk factors include a family history, a history of undescended testes or congenital inguinal hernia, embarrassment delays many young men with testicular swelling seeking medical opinion. There is no evidence from randomized controlled trials, and it is unlikely that such trials could ever be designed to prove that regular testicular self-examination reduces mortality. It stands to a reason that early detection before metastases have developed reduces the need for toxic therapy such as major abdominal surgery and chemotherapy. So next is the prostate disease. Many men may find it embarrassing to talk about lower urinary tract symptoms or LUTS such as nocturia or urge in incontinence and rejection of the urinary system symptoms which could indicate benign prostatic hypertrophy. Men may also be embarrassed to undergo a digital rectal examination which forms part of the assessment for prostatic concerns. Next is the importance of proper taking care of it, or the proper taking care of the male reproductive system. It is one of the most important parts of the body, and maintaining good reproductive health is essential to sexual development and procreation. However, men often tend to overlook their reproductive health, and as a result can lead to numerous complications and diseases. So how to take care of male reproductive system? First, regularly screen for STD, practice good hygiene, maintain a healthy lifestyle, quit smoking, visit your doctor, and also regular screening for STD. So practice good hygiene. It is one of the simple enough to follow. Wash your genitals regularly to prevent the accumulation of dirt and germs in your genitalia that can potentially cause infections. Maintain a healthy lifestyle. Another important factor is drinking plenty of water. This will help flush out your kidneys of the toxins in your body. Through your urine. When you drink enough water, the urine is light in color and odorless. So, quit smoking. Most doctors will agree that smoking can be a major contributing factor to sexual dysfunction in men. Past studies have shown that majority of men who suffered from erectile dysfunction were found to have been smokers.
So these are the summary of our assigned topic. The male reproductive system comprises various of external and internal organs. The external organs comprises the testes, penis, the scrotum, and epidermis. So, the internal organs includes the spermatic cord, the prostate, the bulbourethral gland, and the seminal vesicles. These organs work together to facilitate reproduction and sexual function. Namely, this system assists in producing sex hormones to initiate puberty and enables a person to produce and transport sperm. Many male reproductive system problems could be perceived as being embarrassing, which may be one of the reasons that they are not identified in general practice. There are also known illnesses of the male reproductive system, which are the erectile dysfunction, prostate disease, libido, premature ejaculation, and testicular cancer. However, all of this can be avoided when you avoid something like smoking, drinking alcohol, and many more. Above all, in order to have a healthy reproductive system, always check and see the doctor. That would be all. Thank you.